Hello there and welcome to A Healthy Nigeria, where the journey to a stronger and more resilient health sector is already ongoing. Join us as we explore the transformative efforts to reposition Nigeria's health sector from manpower development to cutting-edge equipment, funding, and emergency preparedness. This is Reshaping Democracy, and I'm Ayo Deji Makinde. Getting an insider perspectives on the reforms revolutionizing primary up to tertiary healthcare provision is Nigeria's Minister of Health and Social Welfare, Professor Muhammad Ali Pate. He will be answering questions from citizens curious to know developments in this vital sector of our national life.
My name is Honorable Chief Dr. Billy Famous Adeso Asawaru. I represent the good people of Orion Federal Constituency at the Federal House of Representatives. I'm from Edo State. My question is what measures or strategies are in place to actually bring about enough healthcare workers, especially in the rural area?
Well, as you know, President Bola Ahmed Tinubu unveiled a health sector renewal investment initiative last year, which required a collaboration between the federal government, state governments, and local governments, alongside the private sector and development partners. Within that, the first pillar is governance and responding to the needs of citizens. We had a People's Voices survey, which gave us a sense of what Nigerians expected, what their experiences were in 2023, and we repeated that now in 2024. As it relates to the human resources, it's linked to Pillar 2 of our agenda to improve Nigeria's health system, to deliver primary healthcare, secondary healthcare, and tertiary healthcare to the quality that Nigerians needed. So not only have we tried to expand the basic healthcare infrastructure to the primary healthcare system, using the basic healthcare provision fund as a vehicle, to more than 8,000 primary healthcare centers. We've also expanded the infrastructure in the tertiary hospitals that are under the Federal Ministry of Health and equipping them. For human resources, we doubled the quota of training of medical students, pharmacy students, midwives, other healthcare workers, so that we can produce more. And we also passed a policy on health workforce migration, which has 5 components. One was to provide the incentives to recognize and those who serve in rural areas, to improve the working environment, to deal with the work-life balance of health workers. It's all embedded in the policy and it's on our website for any Nigerian to look at. It was developed in a participatory manner. It also looked at the issue of capacity building for healthcare workers so that they are equipped to be well positioned to serve well for the ones that exist, the quality of the health workforce itself. We announced a retraining of 120,000 frontline health workers. As it is, more than 40,000 frontline health workers have been retrained with new curricula all over this country, and more will be retrained up to 120,000. And this was the reason why the African heads of states recognized President Bola Ahmed Tinubu as the African Union's champion on human resources for health and community delivery at the meeting of the African Union in Addis Ababa earlier this year. In addition, we have taken steps to ensure that the higher level professionals also have opportunities to be retrained. We've worked with professional associations and unions to ensure there is stability, there is mutual respect, among the medical team, which is comprising of a diverse set of professionals. And that stability we intend to continue. The third element of the policy that was passed was what we call ethical recruitment and health diplomacy, to ensure that the professionals who are aware that our Nigerians are able to come back if they want, that those that are here are appreciated, and we appreciate them. There are many health workers that are working very hard under difficult circumstances, but at the same time, for where they are going, for them to be appreciated and for to call on other countries to invest in expanding the training of our healthcare workforce. The fourth element is on research and using data to guide the action, to iterate, to see where are the gaps, where is the distribution, how do we change it, but use it based on facts. And finally, to establish a governance mechanism. This was through the National Council on Health and a program in the Federal Ministry of Health on the human resource, so that we have a governance, a team dedicated to look at the human resources, the welfare of the health workforce, as well as the capacity that they have, and addressing things as they come, whether it's on their recruitment or on their deployment. The president also did an important thing earlier this year in terms of delegating the waiver for recruitment of healthcare workers to the Federal Ministry of Health, together with the Office of Head of Service, with Budget Office, with other relevant parts of government, to streamline the way doctors, nurses, pharmacists, lab scientists are recruited. All in all is to say that the federal government has led by example, is continuing to pursue that. And we're seeing many states also increasing their focus on the health workforce. We hope local governments will also pay equal attention to this area, because together, all of us are the pieces, the levers that will ensure the health workforce remains, is of the quality that is needed to improve the health of Nigerians. Health workforce is the lifeblood of the health system.
My name is Derek Uhuago. Honorable Minister, sir, I'd like to know what plans are on ground towards upgrading our medical infrastructure as it relates to clinics, hospitals, and diagnostic centers. What have you done to improving access to quality healthcare as it relates to all of this?
There are many things going on to revamp infrastructure. The truth is that for many years, Nigeria has not invested in the infrastructure and equipment of facilities in our health system to the level that we need. But this administration took that front on. The revitalization of primary healthcare is underway with resources, what we call impact resources, across the 36 states. The bill of quantities have been developed, the procurement process are underway. It should be done by states, but under a framework that was developed with the federal government and the resources developed, mobilized by the federal government. At the higher level, in this year, for instance, you know that there are 6 major investments in cancer infrastructure and equipment that were approved by the president. And those investments, we have put them in the budget. The funds have been made available, have been transferred to the Sovereign Investment Authority, and the procurement of the equipment is already underway and is directly from the original equipment manufacturers, taking away middlemen and resulting in a saving of almost 30%. So that by May 2025, at least 2 of those cancer centers will be commissioned and the rest will follow. And in addition to that, through NSIA and the MedServ, 10 major health infrastructure projects are underway. We did the groundbreaking of that at the Abuja University Teaching Hospital in Bauchi, of 8 diagnostics and 2 oncology centers across the country, one of which was in Bauchi. And those projects are underway. And in the last 2 months, if you see the progress of work, is already amazing, and it's happening in 10 centers. That has never happened in Nigeria, whereby the federal government is investing massively in the infrastructure equipment. Is it enough? No, but it's a big start, and we need to continue investing and revamping the health infrastructure, playing catch up, because we should have been investing more in our health infrastructure, but we have not done it for years. And now this president has focused on transforming the Nigerian health system, and we're going to continue what we've started in 2024 into the years ahead under the leadership of Mr. President.
Honorable Minister, sir, my question is, what are the measures put in place in Nigeria in handling cases of epidemics and pandemics, including emergency response, vaccination programs, and surveillance in Nigeria?
That's the 4th pillar of the president's agenda for health, to improve health security. And we see that Nigerian health security is linked to the regional health security and African health security and the global health security. and by repositioning the Nigeria Center for Disease Control to be able to prevent spillover of pathogens from the animal to human health arena, by enhancing surveillance mechanisms so that we check and pick up outbreaks when they're very early stage before they expand and spread, to be ready to respond through epidemiologists and the capacities that exist, and to work with the subnationals so that we are coordinated in how we respond to all of these issues. And we've seen improvements. If you recall, in late 2023, when this administration came, Nigeria was facing a massive outbreak of diphtheria. We put a task force, we mobilized vaccines, working with the states, 14 states, that is now receded. Early this year, we had outbreak of meningitis, Yobe, Gombe, a few states. We mobilized we're the first country in Africa that deployed the polyvalent meningococcal conjugate vaccine. It was a pentavalent vaccine. We deployed it, and that outbreak was stunted. In that cholera, when it started, we mobilized. You remember Lagos, Rivers, it was raging. Yes, thousands of cases of and yes, there are still some parts of the country where it's still happening because of issues of sanitation, open defecation. But we're able to mobilize cholera vaccines, to mobilize support. Even when the flooding in Maiduguri occurred, we mobilized quickly in terms of water, working with partners, working with the state government to ensure that it doesn't result in major disease outbreaks. When Mpox started, even before the regional emergency, we were able to stand up a public health response. We mobilized the first vaccine in the continent to be available in Nigeria, and Nigeria was able to donate some of the doses that we received to a neighboring country, to our brother country, Rwanda, from Nigeria, because Nigeria was able to organize itself. And of course, that was very appreciated. We are continuing using the One Health approach to ensure that we have surveillance on antimicrobial resistance in the country. We launched the Institute of Genomics, which is at the Redeemers University. It's a private university, but it gives you a sense of the capabilities that are being built to safeguard the health of Nigeria and to protect their security. When you look at other diseases that are transmitted across the borders, we are working with our neighbors as well. I think the synchronized polio campaigns that we had planned is still on the table, and we hope that our neighbor Niger will be able to work with us. We're working with many countries in the sub-region, in the ECOWAS region.
My name is Comrade Bulama Abiso, the Executive Director of Network of Civil Society Organization in Borno State. I am speaking in Maiduguri. Sir, as regards to funding, what mechanism is the ministry put in place to see that international donors, civil society organizations, INGOs, all put their things on one basket in order for it to reach out to the community on ground?
Several strands of funding. Because of the respect that Mr. President has earned for Nigeria and his focus on health in particular, we saw development partners when they came to the unveiling of the Health Sector Renewal Investment Initiative on December 12, 2023. They announced $3.3 billion over the next 3 years contribution to Nigeria's health sector transformation. Some of those resources are through the Global Fund, channeled through implementing entities. Some are bilateral sources, and some are grant resources channeled through government. And some are multilateral financing through the International Development Association to support the sector-wide program that we're implementing. But that's not it. The federal government itself, under the president, have increased the allocation to health in 2024, and we expect that to continue consistent with the direction of the administration. And we expect states to also meet us up, because they also have to contribute. And for local governments also to take the health, because health requires all levels of government to do more. So that has to happen. Now, the private sector has mobilized its own type of capital. Private sector cannot give money to government, but they can invest. We're seeing health infrastructure, equipment, service delivery points being developed by the private sector. We're also seeing interest from the private sector in manufacturing of pharmaceutical products, because they will create jobs and there's economic value in there. We're seeing the Federation of Nigerian Pharmaceutical Industry Association mobilizing and establishing new plants, establishing ways to produce drugs that were in the past imported from to the country to begin to produce that. We're seeing things like rapid diagnostic kits, which until 2023, there was nobody that's producing it here in Nigeria. Now we have one already producing, and we'll have more producing to unlock the healthcare value chain. We're exploring innovative financing through our bilateral partners, mechanisms that basically allows us to front load health resources. These are innovative financing mechanisms. For instance, debt for health swap. These are still early days. I'm not saying that it's for sure that we'll be able to do that, but we'll have to explore different ways, public-private partnerships, to ensure the private sector joins the public sector in a way that is well governed, that is market tested, that will deliver value for the public as well as for the private. Those are all the mechanisms that we are looking at to implement the transformation agenda that Mr. President has put forth.
My name is Lucy D. Yunana from Maiduguri, Borno State. Minister, sir, how will the ministry ensure effective monitoring and evaluation of health care programs and services to assess progress and identify gaps for informed policy decisions?
An excellent question, because a key pillar of our agenda is improving governance. Not only responding to citizens, but also being transparent and accountable, having good quality data. So we put in place a mechanism through the sector-wide approach. We would have the first ever joint annual health sector review, where the state of health of Nigeria would be released, the report, to all Nigerians. People should tune in to what that report will show. It shows the results in terms of where we are with antenatal care, with healthcare utilization, where states are as a baseline. It also includes a perception survey of citizens in terms of health background, but also in the last 12 months. That is data, not just stories, but facts, where we're seeing some very interesting findings, that there is endorsement of the direction of the health sector. There is also confidence by more than half Nigerians in the ability of government to deal with health emergencies. We're seeing evidence that in 12 months, the utilization of healthcare has increased. Measurement of hypertension, blood sugar, cholesterol, dental care, with data, not just stories or intuition. The accountability mechanisms are also being established. The President established a Health Fellows program, which we've mobilized the resources, and the recruitment is underway. There are financial, the performance management and financial officers that are recruited through the MPHCDA to be deployed so that they track, and there are independent verification arrangements that are going to be put in place for the sector-wide program, so that young Nigerians, citizens, will have the opportunity to use checklists to help us keep track that the resources that we're investing in the primary healthcare system, for instance, or in our hospitals, that they are going to intended places. The Basic Healthcare Provision Fund, which has channeled billions of naira to the 36 states through MPHCD Gateway, through NHIA Gateway, and to the State Health Insurance, we're revamping it so that we ensure that the resources are not diverted at the front ends when they get to the primary healthcare centers. So the issue of accountability is very front and center to this reform agenda.
I'm Dr. Adeyemi Famous. I'm the president of the Association of the Resident Doctors, Ekiti State University Teaching Hospital. I'm a public health physician. The Honorable Minister, sir, I want to know, how will the ministry enhance primary healthcare services, including the world minimum healthcare package, to improve health outcomes and reduce morbidity and mortality rates?
According to the extant policy that exists, primary health care is primarily responsibilities of the subnational levels, is states, local governments. federal government supports states and local governments to implement primary health care. So federal government doesn't have one primary health care center that it is responsible for. But it cannot back away and say it's not interested, because primary health care delivers services to Nigerians in the remotest areas, the poorest and vulnerable, the women, the children, delivers vaccination and all that. That's why the National Primary Health Care Development Agency is supporting and working with the state governments who have this primary health care under one roof, the state primary health care development agencies, as well as the local government, to ensure that it all goes in the same direction. The Basic Healthcare Provision Fund is 1% of consolidated revenue, and it's coming from the federal government portion of our own federation account, which goes to all the states. Federal government also spends billions of naira every year to procure vaccines for all Nigerians, for all Nigerian children. All the vaccines that are being supplied in our primary healthcare centers, the public vaccine, the routine vaccines, are funded by the federal government. So federal government is really throwing its weight, knowing fully well that all the arms of government, federal government and subnational levels, have to work together to invest, to implement programs, to monitor, to ensure that the health of Nigerians is safeguarded, and particularly the poorest and most vulnerable. On the insurance side, to ensure the Vulnerable Groups Fund, which is funded by the federal government, also is met by the state government through their equity funds, so that we expand affordability of care to all Nigerians. There are many interventions in that regard which have been implemented as part of this, but we're doing it collectively, not just federal government alone. Of course, we throw our weight, we lead, but we also call on states, and we're working with the states very closely to do that, so that together we lift the health of Nigerians to a better place.
For over 200 million population, provision of health services translates to better food, economic and national security. Hence, the determination for a complete turnaround, with emphasis on initiatives leveraging on technology, new infrastructure, expansion, improving diagnostic facilities, and most importantly, access. These are key transformative efforts to strengthen Nigeria's health sector. I'm Ayodeji Makinde. Reshaping Democracy. We'll be back same time, same station next week. Bye-bye.